KeNAAM, it stands for Kenya NGO Alliance Against Malaria, was established more than a decade ago. It was the first KeNAAM Fresh Air Conference in 2001 when a loose network of partners, especially from the NGOs, met in AMREF headquarters in Kenya and decided to share experiences about malaria. The KeNAAM mission is a malaria-free Kenya, and I'm happy to note, despite having being a world dream by then, the Kenya government, through the National Malaria Control Program, has also adopted that as a malaria-free Kenya from the time we incepted that. The importance of this conference, this is the 6th conference. It's called the KeNAAM Fresh Air Conference. Why you call it, KeNAAM Fresh Air Conference, why you call it fresh air? We know that the word malaria is a misnomer. It means malaria, means bad air. And when the first KEFAC was done, is that people said that we need to bring in fresh air to members so that we know what we need to implement. So we keep on doing that, and I'm happy to note that most of you have already said that it is a time to share. And because our theme for this 6th conference is sustaining community partnership and fighting malaria, we believe that we'll be able to share all those experiences, especially things that deal with the community partnership.
I think it is an opportunity that we should take up for us to be able to share our experiences, our strategies, and try to see what we can carry home from here to better our programs for our people.
In particular, I would like the constituency to address the challenges of LLIN used in special dwellings like the Masai Manyatas, and what can be done to ensure that these communities benefit from malaria prevention interventions. I will leave you with the inspiring words of a Masai proverb: if you want to walk fast, walk alone. If you want to walk far, walk together. Let us feel free to share our experiences, to learn from each other, and to work towards fighting malaria in Kenya.
We've come from far. The founders were wondering, what is this KeNAAM going to be? Or is this partnership is envisaged in 10 years?
How do we strengthen towards sustainability? It's about advocacy. It's about commitment. It's about engagement with the real players and transferring that ownership into their hands in a way that it's not just lip service.
The devastating nature of malaria in sub-Saharan Africa. We know that for every 45 seconds, a child dies out of malaria.
Malaria is a life-threatening parasite disease. About 70% of Kenya's population are at risk. When we conducted a baseline survey initially in 2009, it was noted that in churches are the second most reliable sources of information in the community in which we work. So we are targeting the churches also to pass the messages. And because of that, we informed the religious leaders, the various religious leaders in the community, in the areas where we're working, and they are using the church forums to disseminate information about malaria control.
PSI has also engaged the use of Kenya Scouts Association at the community level. The Scout movement is a respected movement. Most people in the community tend to look at them as people who have integrity, people who have a certain way of behavior, people who can be allowed into households to see how the nets are being tied.
So we are also reaching our community on educational events, such as we have school discussions in sex side treated nets usage demonstrations.
So the question is, when you want to control malaria, which tools do you want to use? Are you going to select all the three of them? Are you going to select only one? Or how are you going to select? So the decision process is very important.
An evidence-based, community-based integrated vector management, which is IVM strategy, using a range of interventions selectively to control vector diseases.
An effective malaria or mosquito control program should have mechanism which will test the success in reduction or increase the impact it has on both the adults and the immatures.
Objectives actually were to determine community perceptions, beliefs, and practices related to malaria and vaccines. The second one was to determine household decision-making, treatment-seeking patterns related to malaria and vaccination, and also we wanted to determine service providers' views on malaria and vaccines, and finally determine content for communications strategy.
The objective of our research project was to evaluate to what extent the provision of prepackaged subsidized AL delivered through the private sector would improve coverage of prompt effective anti-malarial treatment,
scaling up malaria case management through health provider capacity development in Coast Province in Kenya.
Well, we tried to specifically, first of all, assess the quality and coverage level of malaria control intervention delivered by all levels of the Kenyan health system. The second one was to identify major funders of malaria intervention at all levels of the health system. Third one was to look at to assess the extent to which malaria control interventions contributed to strengthening the Kenya health system and identify gaps and constraints. And the last was to assess how health system reform contribute to effective delivery of malaria control interventions.
My name is Joseph Over. I work with Kenya News Agency in the Ando District. I'm a journalist.
My name is Esther Kello. I work with the Standard Group, specifically KTN, Kenya Television Network.
I'm Thomas Otieno from Fish FM. I'm here basically to learn and probably go back and report to the society about what I've learned.
I want specifically to congratulate and to note the presence of the media. Interestingly, rarely do we recognize these people as a vehicle for promoting behavior change in health.
And that's why I want you media people to be on call to take the message of what action this group wants to be put out there to be made public.
The media, whenever you have any clarification to do, don't give the community what is not right.
You mentioned that you don't have tools to monitor the proper utilization of the materials. Well, I don't know whether you are talking of all the materials or some. For example, if some of the IC materials are literature, now did you consider the level of literacy, especially in the rural areas, which is more pronounced?
There have been reported abuse or misuse of these nets here in Kenya. A while back, ICPEC conducted a research, especially in the lake area, and they found that
the fisher folk are using these nets for fishing or for drying omena?
I would wish for you to just clarify to us a bit on those intrinsic incentives. The other question is, how well have those incentives worked?
Who is analyzing the challenges for causality? Who is looking at them for changing the situation?
I'm just wondering how sustainable that is, and do you have any information on areas where maybe you had started giving these kangas and pulled out to know whether it's actually feasible?
This conference has been very beneficial to me and many others, especially in reporting health issues like malaria being a very serious disease that has been causing many deaths for children under 5.
And it was amazing how NGOs are really united to help elevate and make sure that malaria is out of Kenya.
I will make you fishers of men, fishers of men, fishers of men. I will make you fishers of men if you follow me.